viewers, this is Lubna Bhayat from 𝐷𝐸MeansWork.com. Yes, it's a job portal, e-academy, an online magazine as well as a consultancy for women. Yes, women. And that is why we have come to you with a series of working women and their health issues. And today we have our guest here, and I have to really take this phone to narrate the degrees and her research papers that she has done. We welcome Dr. Saira Afzal, MBBS, MCPS, FCPS, M.Phil, Ph.D, God knows doctorate, fellow US certifications, and Chairperson and Head of Department, Community Medicine and Epidemiology. To be honest, I don't even understand all the degrees, but looks like you have an extensive experience in women and child health, and you have a lot of researches worldwide. They have been published that you have conducted about women and their health. So we thought that you are one of the best person that we can bring to this platform to discuss working women and their health issue, and especially I want to ask about expecting mother. So new and expectant mothers at work. So welcome, Dr. Saira.
Thank you very much, Lubna, for such a nice introduction. It is always a pleasure to be here with the She Means Work.
Thank you so much. So my first question to you is that once a girl graduates, she goes out to work, she gets married, and then when she's about to expect a child, she leaves her job. So that's it's kind of a norm in this in Pakistan, and that one of the reasons that we have such I think we contribute 15% to job market. Women contribute 15% to job market, 85% are men. So basically, what would be your take on to leaving the job, being pregnant? So is it something that a woman cannot work while she's pregnant?
I believe that our women are same as the other women in all over the world. So it is not a difference in the women as such, but it is the psychosocial pressure that our women are bearing here. You can't even imagine in other countries, because there is a social system of sport. They have a proper system or guidance according to scientific knowledge and evidence. It is not hearsay by that my mother-in-law has said this and someone other mothers-in-law has said that, and you don't have to do any work. You have to keep on bed, and you have to keep your regime, like having fatty foods, etc., and you gain weight and weight. In the end, there is diabetes, there is hypertension, there is an overweight baby, and you are standing nowhere, because active lifestyle that is not only giving the psychosocial contentment and satisfaction to the mother, but also gives a very healthy baby.
Dr. Saira, I want to ask you one thing. You just mentioned overweight. I mean, this is something that I have noticed, that once a girl becomes a mother, she gains weight. So and then if you look into in Europe and America and other countries and even the Far East countries, this is not the case. A woman can be a mother of 6 children and yet very smart, slim and nice. So what is there? Like, what is that? Is this the food or something in the air?
No, it is actually the diet, food and inactivity. I must say inactivity, because all the working women, they are more prone to have an active lifestyle, more prone to have a good sized baby and have a very nicely their body adapted to all those physiological changes that are taking place. I'm not talking more about scientific terms, but this is how, if the mother is active, the baby's brain that is growing in a better way rather than a sluggish mother or someone who is inactive. So all these things are interrelated. These are the hemodynamic changes that are normal in the first trimester, second trimester and third trimester. We have only the third trimester where there should be a weight gain. Otherwise, in the first and second trimester, if there is
I tell you, like, I've seen a lot of women who are working, they're doing well, well, and the moment they leave the jobs, because it's a family pressure, it's a social pressure. Oh, why you are working? You are going to be a mother who's going to look after your child, so you have to sit at home and stop working. And at the same time, she has a psychosomatic symptoms. She feels depressed because all of a sudden her activity level has gone down, and then she is forced to sit in the rooms and stuff. So what is the difference? What a working woman does, in other countries, that should be adopted by the Pakistani women who are at work and they are pregnant and they are going to be mothers. So what are the I think tricks and to adopt, even with the first trimester, second and third trimester?
Right. If I have to say in 2 words, I would say first nutrition, second is exercise. First, let's see what is the nutrition. Nutrition should be very healthy. There should be extra calories that has to be added in the diet, and it consisted of more proteins and less fats.
Right.
Because we are having more panjiris and fatty food. That is not right for our women. Second is exercise. The active mind is only possible with the activity level of the mother. For example, if there is a working woman, she is going for an exercise. She is producing more hormones that are producing satisfaction in her brain. We have more hormones like serotonin, that is one of the antidepressant. Similarly, they have more social contacts, and these social contacts help in the growth of the baby and also the growth of the mind of the baby, brain of the baby.
Oh, this is wonderful, because so basically what Dr. Saira is saying, with all her research and all her life spent in this field, that working women actually benefit being at work during the pregnancy if they follow certain precautionary measures. So you are saying that being active, being mentally occupied, and with a social contact, the baby can be healthy, and the mother can also be healthy. So this is something new. So basically, you are advocating women that not to leave jobs, but to continue with their jobs and careers even while being pregnant. So what is the time when you think that now it is time that they should take a leave, pregnancy leave or maternity leave, and then they sit at home? What are the signs that they should follow, that okay, fine, now my body is like it's better to take rest? What would be your input?
The uterus is just like a bag. I am coming to your answer of your question, but that is not very simple as saying that this is the third trimester and you have to take the rest. No, this is not so. Uterus is just like a bag, and there is an opening that is called os. If that cervix or os that is opening up earlier, it means the woman needs rest. Otherwise, she can work till her os is not ripened. Ripened means that even at 9 months of her pregnancy, perhaps that is surprising for you, that she don't need rest as such, just lying on the bed till the 9 months. And we have done a lot of research about it. All those women who have a very good os, once they start resting, they have a difficulty in labor pains. They have more labor pains. In other words,
I've seen it in the rural women. They go out, they're working 15 hours in the field, they're looking after the cattle, they're looking after their families, crops, and even cattle, and then making those fuel and stuff like that. But at the same time, they are pregnant and active, and the moment, when there is a delivery time, within few minutes, a few hours, they're done, and they're like mothers, and after 1 week, they're back in the fields. So looks like, they are doing the right thing. And whereas, in the urban women, we have a different concept. So when you said that, the O's, what are the symptoms or the signs that a woman should, or a new expectant mother at work should look at?
Right. The first important thing is morning sickness. That is called hyperemesis gravidarum. Some women has lot of vomiting during the first trimester. These women need special diet, and also they have certain smell-like problems. So they have to be in fragrances, and they have to avoid bad smell, etc. In second trimester, there should be regular hypertension check or blood pressure check, diabetes check, and there is a whole profile profile of hepatitis, testing and other things that should be done. However, once all these tests are negative, that is a good thing. Otherwise, they need follow-up. In the last trimester, the baby is gaining weight. Again, the mother's weight is very, very important in that trimester, and it should be regularly followed up. After 22 weeks of gestation, there should be a regular follow-up for blood pressure, sugar, and all those physiological changes that are taking place.
So fantastic. So basically, the message is you don't have to leave work, and if you want healthy baby, you want mentally healthy environment, be active and look for the signs that Dr. Sabah has already stated. So if you have any questions regarding our segment, please, our email and our phone number is there. If you want to ask something to it, Dr. Saira, inshallah, in the next program we'll invite her and she'll address your questions. And if you like this series, please subscribe our channel and don't forget to click the icon button and visit our website www.𝐸-𝐸𝐴.com. It's a website for the women and for you.